lot of confusion these days about Medicare and Medicare supplements and Medicare Advantage and things of that nature. Frankly, there's a big push to get people onto Medicare Advantage by the government. They'd love for you to be in a managed care program. I will tell you from an experiential standpoint, you probably don't want to do Medicare Advantage. Now, it's cheap. Absolutely. Sometimes it's no expense depending on where you live and that type of thing. But I have had a lot of people come back and say, you know what, that is just not what I need to do. Janet, we believe that Medicare and a Medicare supplement are your best lines of defense as far as medical costs are concerned, because a supplement basically fills in on the deductibles, coinsurance, and the things that Medicare does not cover.
And those things combined together are going to cover what you need until, John, they don't. When you get to the point where you need a higher level of care, maybe you need some degree of long-term care either in your home or in an assisted living facility of some type, at that point it's very important to understand that the government is not going to cover those costs through Medicare. Let's distinguish for a moment between Medicare and Medicaid. I always give this little easy to remember way for people to think about the difference in the words. We care for the elderly. We aid the impoverished. So Medicare does not cover long-term care. Medicaid can cover it, but remember, we aid the impoverished. That means that if you have assets, it's not going to cover you. You actually have to spend down your assets to a level of $2,000 before Medicaid will come in and help with long-term care needs. And at that point, because the state is then paying for a bill that was really yours to pay for, then this is where people get confused. They talk about, well, I don't want the nursing home to take my house and that type of thing. They're not going to take your home if you pay your bill, and they're not going to take your home just because. But if, let's say, the state pays for, say, at $5,000 a month for a year's time, the state pays for $60,000 of your care. Well, that came out of the state's budget, not out of your cash flow. And so when the house is sold later on, then $60,000 of value from that is owed to the state to make, true on the bill that they paid for you. So that's where that comes from. But they don't just show up, and take your house. That does not happen. So what we want to look at, though, is how do you get out of a need for the government to be involved at all? Because, John, we've seen a difference in the level of care very clearly, whether it is self-pay or insurance versus Medicaid coverage. That's not really where you want to be. And so if you're in a position to be able to look at long-term care insurance as an option, I will say that is something that if I were in your shoes, I would consider it. I'm not saying that everybody needs to have it or that it's the right thing to do, but I am saying that you need to look at it and intentionally, this is the key, intentionally check the box on making a decision about whether you want to have and need to have long-term care. After you've made that decision, move on, because what we see very often is people will postpone the decision. Well, let me think about it. Let me consider this or consider that. And there's never a day when they wake up and go, this is the day that I'm going to make a decision. And so they go a few years down the road. Well, those premiums are now higher. And so it would have made more sense to lock it in. So anytime from about age 55, and really I won't put a cap on this, but it does get to a point where it doesn't make sense anymore from a cost standpoint. But 55 and up, if you have not made an intentional decision about long-term care, you need to.
Janet, let's also talk about something that nobody really wants to have to think about or deal with, but you have some degree of control on your utilization of health care when you as you move into retirement. And what I mean by that is if you are proactive about your health, and guys, I am talking to you. I am one of those that I try to avoid the doctor's office at every turn, and I know most of you guys are like that as well. But I will also say that in the last probably 5 or 7 years or so, I have been very proactive
Yeah.
about my health. I have a regular standing appointment with my primary care physician, and he does a whole battery of tests on me and has found some things that we are being proactive about, trying to be sure that they are not problems for me as I get older. And I think that oftentimes we think we are saving some money by not going to the doctor, and we're saving some discomfort or whatever. You just are irritated about the whole idea of going through the medical system. So and this is clearly where an ounce of prevention is worth a pound of cure.
Yeah.
And I think that most people don't really understand how much power they have in their own control to control their healthcare costs.
Yeah, absolutely. Being proactive. I mean, I think that's a recurring theme at GenWealth on really any topic. So your health is included in that because that allows you to be proactive with your finances as well.
All right. You've got a question, we've got answers. You can text us or call us at 501-381-5228. That's 501-381-5228. We'll get your questions answered here on the Get Ready for the Future show.